Well, headaches, neck or back pain, joint pain, if you're experiencing any of those, it really disrupts your life.
At Momenta Pain Care, they focus on helping patients move forward. They do it with compassion and innovation.
All right, let's learn a little bit more with Dr. Pete Piperis. Good to see you, Doctor.
Nice to have you here.
Thanks for stopping by.
Thank you.
You know, we've got all kinds of things that bother people when it comes to pain, from the head down to the feet. So what type of pain management do you guys specialize in?
Well, we are comprehensive in our approach to pain, so it may very well be things such as medication management, directing physical therapy. A lot of what we do as well is something we call interventional pain management, which are different types of injections to really target the patient's pain and treat it, and try to do as best a job as we can to minimize the use of medications and other things like
How
that.
prevalent is it? How many people come to you? What do you know about the numbers?
This is an enormous problem. By last estimates, about 100 million Americans suffer from chronic pain, and that's about 1 in 3. And what's an interesting statistic is that if you take diabetes, heart disease, and cancer combined, pain affects more lives than those 3 conditions combined. Wow. And then if you take those people that suffer from pain and you talk about headaches and neck pain, that represents probably about 1 in 3 patients of the community. So really, people walking around us, about 1 in 6 or 1 in 7 suffer from chronic neck pain and headaches.
So chronic neck pain and I like how your website says life begins when pain ends, because so many people go through life in pain, they're not enjoying life as much as they should be or as they could be. And so when it comes to neck and back pain, what specifically do you treat? What do you look for?
Well, specifically, if we're talking about neck pain and headaches, a lot of times we get a lot of referrals for headaches. But interestingly, when the patient shows up in our office and talks about their neck pain, if you just listen to them, they'll tell you about how much neck pain they have with their headaches. And although they may have been referred for headaches, neck pain is a significant component of it. And when you lay your hands on the patient and examine them, it's amazing how many of them are just exquisitely tender to palpating over the cervical facet joints or the muscles in the neck.
Just to the touch, right?
So
Oh, yeah.
how do you treat those patients? What can you do for them?
Well, one thing I'd like to say is that our community here does a fantastic job treating these patients. Primary care physicians, neurologists, neurosurgeons, physical therapists, chiropractics, we collaborate with all of them. And that is important for the patient because you want to make sure your diagnosis is right. You want to make sure the patient may not have something rare like a brain tumor or a problem with circulation in the brain. Regarding the spectrum of therapies out there, they range from simple things like telling the patient to modify their activity or take Advil or Tylenol. We instruct them to perform home stretching exercises, and they may progress on to physical therapy. Many times by the time the patient sees me, they've gone through all that and have not responded to it, and that's where I get involved. My specific application or my approach here to this type of headache, or this, what we call a cervicogenic headache or cervical facet syndrome, is we will perform a series of diagnostic injections in the neck. And it's very precise. We do it under x-ray. And what we do is we inject local anesthetic around those joints, and we tell the patient to go home, have a normal day, and let us know if their pain was relieved by that. And that's how we kind of make that diagnosis or confirm that diagnosis. If in fact the patient gets tremendous relief from that diagnostic block, they're a good candidate for something called radiofrequency ablation. And you may hear that more and more in the community, rhizotomy, radiofrequency. What that is the application of heat to those joints. And when you apply heat to those joints via a specialized needle, the patient can get prolonged relief.
How long does it last for a typical patient?
The most studies, if you look at the studies, which are good studies, and this has been going on for about 20 years or so, 6 to 12 months.
Wow.
My practice seems to mirror closer to the 12-month range. And when the pain comes back, we can retreat the patient. Most of them do not mind going through the procedure again if we've been able to take care of their pain.
That's
for
fascinating.
It is fascinating. How about, listen, I've had low back problems. How about low back pain? The same type of procedures or treatments?
Well, low back pain has a lot of causes as well. However, this facet joint pain is very common in the low back, and The results are about the same. The therapies are the same. And again, you really want to make sure you're comprehensive with the patient and that they start with the simple things first before you start subjecting them to procedures and things like that.
The treatments that you're talking about here today, and I know there are others because this world is quite complex, and so we'll send you to the website momentapaincare.com to learn more, to see if maybe it's specific to you or these treatments could be. But are they ever covered by insurance? What can you tell us about that side of things?
That is a great question, because many times therapies are advertised and people talk about them, and many insurance companies will consider them investigational. However, because the evidence for this type of treatment is so strong and established, that these particular procedures are covered by insurance.
Yeah, we talked about headaches, neck pain, lower back, but there's many other different areas of the body you treat with pain. From like, can you name 5 or 6 of them real quick?
Head to toe, yes. Arthritis pain, neuropathy pain such as diabetic neuropathy, fibromyalgia, some other types of pain syndromes called complex regional pain syndrome, and there's a whole
And there's
list.
a whole list on the website. I'd encourage people to go to momentapaincare.com to see if any of those symptoms on that website, you have a page specifically for different types of pain.
Does your family physician have to refer you on, or can our viewers just call themselves without?
They can call themselves.
Yeah.
You don't need a referral. However, I will say, in the interest of the patient, it really is a good idea that if they do have records from this problem, they should send them to us beforehand so we can kind of review and see what they've been through. So we're not starting from the beginning when they see us. And I very much like to communicate with a lot of their physicians so the right hand does know what the left hand's doing. And when they see their primary care provider, they understand what we've done and how we worked with the patient.
That makes sense.
It does make sense. A lot of sense.
Thank you, doctor.
You're welcome.
It's great to have you here.
Yeah, nice to meet you.
Pleasure to be
Appreciate
here.
it.
Yeah. All right.